Hello, everyone. Welcome to Prime Care Nursing Practice Program. The Prime Care Nursing Practice Program is a comprehensive training program designed to equip nurses with the knowledge, skills, and clinical reasoning required to deliver high quality for prime care nursing practice and telehealth care. Telehealth has become an essential mode of healthcare delivery, particularly in settings where distance, workforce shortages, and infrastructure constraints limit traditional face-to-face care. For nurses and midwives in prime care and expanded practice roles, telehealth is no longer optional. It is a core clinical competency. In Nigeria, telehealth is limited by poor internet connectivity, unreliable electricity, high data costs, inadequate digital infrastructure, and low digital literacy, particularly in rural areas. Despite these challenges, it remains a valuable tool for improving access to quality healthcare when supported by appropriate infrastructure, training, and policies. The Telehealth Practice for Prime Care Nursing Practice course has been developed to equip nurses and midwives with the knowledge, clinical reasoning skills, governance awareness, and communication competence required to deliver safe, ethical, and effective care through virtual platforms. Unlike technology-focused telemedicine trainings, this course emphasizes on clinical judgment, structured communication, escalation safety, and lastly is professional accountability in remote care settings. It recognizes that telehealth is not merely a change in location, but it is a transformation in how clinicians assess risk. It interpret limited data, communicate urgency, and protect patient safety without physical proximity. The course draws on real-world telehealth workflows, policy frameworks, ISBR-based escalation systems, and African context realities such as low bandwidth and phone-based consultations. The course prepares participants to practice telehealth with confidence, discipline, and clinical integrity. Clinicians should recognize that telehealth is not the first-line approach to patient care. Use in-person assessment whenever possible, as it remains the preferred standard, especially for patients with complex or unstable conditions. Clinicians should also use telehealth only when clinically appropriate or when access to face-to-face care is limited. Clinicians must recognize the limits of remote assessment and promptly involve more experienced or appropriately trained healthcare professionals whenever there is uncertainty or a risk to patient safety. Next is the rationale. Healthcare systems worldwide are experiencing increasing pressure from rising patient volumes, chronic disease burden, workforce shortages, and geographic inequities. Telehealth offers a powerful solution, but only when implemented by clinicians who understand its clinical limits as well as its strengths. In many adverse telehealth outcomes, patient harm does not arise from technology failure alone, but from inadequate clinical reasoning with incomplete data, poor escalation decisions, unstructured communication, unclear scope boundaries, and lastly is delayed recognition of deterioration. Advanced telehealth practitioners are often the first clinical point of contact in telehealth settings. They must therefore be trained not just to conduct a virtual visit, but to recognize red flags without physical examination, apply structured reasoning under uncertainty, escalate appropriately using standardized communication, practice within legal, professional, and ethical boundaries, and lastly is maintain patient trust and safety in virtual encounters. This course responds directly to these needs, by embedding telehealth practice within a clinical governance and reasoning framework, ensuring that participants are prepared to deliver care that is safe, defensible, and aligned with professional standards. We have come to the end of this session. Thank you for watching. The course overview continues in the next session. See you in the next session.